When it comes to wellness, immunizations are something we really need to keep up with all of our lives. Join me as I meet with Dr. Joyce Thomas of the Tampa General Hospital Family Care Center to learn more about the importance of immunizations. Shots may hurt a little, but the diseases they can prevent can hurt a lot more. Immunization shots or vaccinations are essential.
A vaccine is a preparation that prevents certain diseases. Now, there are certain diseases that will cause serious health problems and maybe even death. Before vaccines were available, you had to, the only way to become immune to a disease was to actually get it and hopefully survive it.
Current recommendations for vaccinations or immunizations are based on guidelines by the Centers for Disease Control, the American Academy of Family Physicians, and the American Academy of Pediatricians.
They are given according to a specific schedule. Now, these vaccines may protect against specific diseases such as tetanus, measles, mumps, hepatitis B, for example.
Immunizations are important for adults as well as for children. Here's why.
So there are certain vaccinations that you need as adults. One of them includes the meningococcal vaccine. The meningococcus virus can cause severe infection, meningitis, and even death. And usually people will need this before they enter high school or college. Another vaccine that's important throughout adult life is the vaccine that protects against tetanus, diphtheria, and pertussis. And then a third one is recommended for females up to the age of 26. That's the human papillomavirus vaccine. And we know that the human papillomavirus causes genital warts and cervical cancer. The influenza vaccine or the flu vaccine, that's needed every year, especially if you're above the age of 50. When you're above the age of 60, what's important is a vaccine called the shingles vaccine. Now, shingles is caused by the reactivation of the chickenpox virus. So when you have shingles, you can have a lot of suffering and pain. Another important vaccine when you're above the age of 65 is the pneumococcal vaccine. Now, the pneumococcus bacteria can cause severe pneumonia, meningitis, bloodstream infections, and even death. So all these are very important.
Flu season spans from November to March each year, so remember, keep up with your flu vaccine.
The flu vaccine or the influenza vaccine is very important. It's required every year. The influenza virus, as we all know, the flu virus can cause severe and fatal pneumonia and of course the flu. Now, the vaccine for the flu is made from viruses that are killed or inactivated. So you cannot get the flu from the flu vaccine or the flu shot. What you may have is some side effects at the site of injection, such as soreness or redness and maybe some fever. But to have a reaction to the flu shot is very rare. People talk about getting sick after a flu shot, and what can happen there is maybe they're exposed to somebody who's had a flu virus that's not in the vaccine you may have received, and therefore you might get sick. But you cannot get sick from the flu shot.
It's back to school time, so parents, listen to what's important for your children.
Before your child enters school, there are certain vaccinations that she or he might need. So they include the measles, mumps, rubella vaccine, that's all in one. Another vaccine that's important is the vaccine that protects against diphtheria, tetanus, and pertussis. Another important vaccine is the hepatitis B vaccine, and also the vaccine that protects against Haemophilus, which can cause severe pneumonia. In the case of an emergency, I think the best preparation is to stay well informed so that you can keep your family healthy. So you can take actions such as covering your mouth and nose when you cough or sneeze, frequent hand washing with soap and water, and maybe staying home if you're feeling ill. Another important tip is to always follow public health advice regarding school closures and crowds. If you want to be proactive about your health and knowing about your vaccinations, remember that vaccines are very important. They prevent certain diseases. The vaccinations are not just for young children, they're for adolescents and adults as well, so you should keep up to date with those. And in the case of an emergency, it's best to be informed so that you can be prepared. Speak to your doctor about how you can keep track of what vaccines you might need and how you can remember what's needed at your next visit or in the months to come.
That's great advice that Dr. Thomas shared with us. It really is up to us to make healthy choices. Begin with a single day. Eat right and exercise. Do well for yourself. For Spotlight Tampa, I'm Carla Kippy.